What is viral hepatitis?
This is a very common issue in this atmosphere, in this season of the year. So, viral hepatitis is an inflammation of liver which is caused by some virus. What is hepatitis? By the term hepatitis, we mean that there is inflammation of liver, patient gets nauseated, there is vomiting, jaundice, loss of appetite, some other manifestations, along with raised liver enzymes.
How we go about the treatment?
As it recovers on its own, so there is no specific treatment for acute viral hepatitis, and we generally treat patients symptomatically. If there is vomiting or if there is nausea, then we prescribe some drugs which can reduce it. If there is fever, we can prescribe paracetamol, and we ask the patient to take normal diet if there is no nausea or vomiting, and these symptoms usually subside with these treatments in most of the cases.
What is the risk of complications or risk of chronicity? You have already
Yes.
discussed a little. So,
Generally, viral hepatitis, acute viral hepatitis improve on their own. But in some patients, like immunity is compromised. If the patient is taking some steroid kinds of drugs or taking some cancer chemotherapy, very old age patients, these patients are at risk of developing chronic hepatitis from hepatitis E, not from hepatitis A. But hepatitis A generally never causes chronic hepatitis. And for hepatitis B and C, it is their inherent property to proceed to chronic hepatitis, but there are some risk factors. Suppose an infant is developing hepatitis B infection, so his chance of developing chronic hepatitis is much more than an adult person getting hepatitis B infection. So, earlier the age of acquiring infection for hepatitis B, more is the chance of chronicity.
hello everyone. We are here again with another podcast. Today our topic is viral hepatitis. I am Dr. Riya Shah, MD Medicine, and we have with us Dr. Krishanu Boni, DM Gastroenterologist, who is also gold medalist. So, sir, starting with the podcast today, what is viral?
First, I'd like to welcome you back because due to some technical problem and assignments of yours, you could not make it. But we are happy that you are here again. So, welcome you back.
Thank you, sir. So, starting with the podcast
Yes.
today, so what is viral hepatitis?
Look, this is a very common issue in this atmosphere, in this season of the year. So, viral hepatitis is an inflammation of liver which is caused by some virus. Now, what is hepatitis? By the term hepatitis, we mean that there is inflammation of liver, patient gets nauseated, there is vomiting, jaundice, loss of appetite, and some other manifestations, along with raised liver enzymes in blood. If we test, we get the liver enzyme raised. So, the constellation of these symptoms and signs, we call it hepatitis, and obviously it is caused by virus, so viral hepatitis.
So, what are the common strains of virus that are causing viral hepatitis?
There are 4-5 virus which commonly affects our liver. In this time of the year, commonly the waterborne virus, that means hepatitis A and E virus, are most common for causing viral hepatitis. And apart from that, there are some other virus like hepatitis B, hepatitis C, hepatitis D, and some non-hepatotropic virus, as we call them, which can also infect or involve liver, but not preferentially. So, like herpes, cytomegalovirus. So these are less common. These hepatitis A and E, these are most common virus causing viral hepatitis during this rainy season, and of course hepatitis B, C, and
Then, you have already discussed the symptoms of the disease, but will you please elaborate on the symptoms a bit more?
yes. because it is very important to know that I'm getting or one person is getting viral hepatitis. First, they have a symptom of 2-3 days of fever, body ache, headache. Patient gets their appetite is lost, and patient feels nauseated, vomiting. Now, once this fever and all these symptoms start to subside, the eyes become yellow and urine becomes yellow, and also the stool color may become pale, and there is itching sensation over the body. So this is the typical presentation or typical manifestation of viral hepatitis. So if somebody is developing these kind of symptoms, then viral hepatitis should be kept in mind, particularly during this.
Since it's waterborne, so in this rainy season,
Yes.
all should remember that.
Yes.
And how long can this disease or illness persist?
Yes, it generally persists a few weeks to few months. For hepatitis A and E, it generally subsides within 3 months, and sometimes in few cases the illness may extend up to 6 months to 12 months, especially the liver function abnormality. But clinically, patient becomes well within a span of 3-4 months. And to talk about hepatitis B and hepatitis C, if there is acute hepatitis B infection, it also improves within a span of 6 months. And hepatitis C, acute hepatitis C is not generally clinically perceptible. So it in most of the cases it causes chronic hepatitis. If patient gets chronic hepatitis, which means the hepatitis is persisting for more than a duration of 6 months, then it can persist for years, even life. So not for hepatitis A and E. Hepatitis A and E generally do not cause chronic hepatitis. They usually subside within 3 to 6 months in more than 95 to 99% patients.
So patients should not worry if
Yes.
they are getting A or B.
Almost always recoverable.
So when a patient is getting the symptoms, it should alarm them that now we must go to doctors. So when they are coming to us doctors, what are the diagnostic modalities that we go forward that patients must know about?
Yes, primarily hepatitis is clinically suspectable, and we generally prescribe some blood tests and ultrasound on the basis of patient's clinical symptoms. And simple clinical tests like test for hepatitis A, E, and B virus can diagnose acute hepatitis. Also, we prescribe ultrasonography of abdomen to look for any other causes. So these are the very simple tools, and the diagnosis is in front of you within a span of 6-7 hours.
So after the diagnosis is made, how we go about the treatment?
Look, as it recovers on its own, so there is no specific treatment for acute viral hepatitis, and we generally treat patients symptomatically. If there is vomiting or if there is nausea, then we prescribe some drugs which can reduce it. If there is fever, we can prescribe paracetamol, and we ask the patient to take normal diet if there is no nausea or vomiting. And the symptoms usually subside with these treatments in most of the cases.
What is the risk of complications or risk of chronicity? We have already
Yes.
discussed a little.
So generally, acute viral hepatitis improve on their own. But in some patients, like if the patient's immunity is compromised, if the patient is taking some steroid kinds of drugs or taking some cancer chemotherapy, very old age patients, these patients are at risk of developing chronic hepatitis from hepatitis E, not from hepatitis A. But hepatitis A generally never causes chronic hepatitis. And for hepatitis B and C, it is their inherent property to proceed to chronic hepatitis, but there are some risk factors. Suppose a child, an infant is developing hepatitis B infection, so his chance of developing chronic hepatitis is much more than an adult person getting hepatitis B infection. So early at the age of acquiring infection for hepatitis B, more is the chance of chronicity.
So, what is the risk in pregnancy?
Pregnancy, yes, it is a very important issue because pregnancy is always a special condition, especially for hepatitis E, which is more fulminant in during pregnancy because some immunological factors. So and also for hepatitis B, if a lady is suffering from chronic hepatitis B, and she is pregnant, so there are some risk to the fetus or to the child within her to get infected. For hepatitis E, the mother is at increased risk of developing hepatic failure, and for hepatitis B, there is risk of infection of the fetus. So these are the two things where also for chronic hepatitis C, where there is child mother to child transmission possibility. So for these hepatitis, there is some increased risk during pregnancy.
So, in case of patients affected with hepatitis, so what are the care? What is the precaution that the caregivers should take, or people surrounding the patients?
Look, this hepatitis A and E are generally transmitted. These are waterborne infections. So they generally transmit through contaminated water, contaminated utensils, or hands of the caregivers. So in during this rainy season, we should follow good, aseptic,
hygiene.
yes, hand hygiene. So before eating food, we should wash our hands properly and should be careful to choose uh, uh, places where we dine out during the weekend. So it is the most common mode of transmission. And for acute hepatitis B, it is generally transmitted by, it is not waterborne, but it can be transmitted in various ways from infected blood products, like those who share needle for injecting drugs for drug abuse, and there is one sexual route of transmission, and another is mother-child transmission. So in those cases also, for hepatitis A and E, hand hygiene is most important. For hepatitis B and C, we should follow that not to practice these, risk behaviors. So these are the precautionary measures.
And for patients, a very common questions in their suffering: what food and what they can have or avoid.
Yes, it is a myth not to go out in the sun, not to take protein-rich or nutritious food, or to just take blunt diet during hepatitis. But it is not so. Hepatitis does not restrict you from taking normal food or doing normal activities until and unless your activity or health is jeopardized by vomiting or by some complications of hepatitis. So in acute hepatitis, we should take normal food to maintain our nutrition. We should do a normal activity, and of course we can go out in the sun. The only thing is that we should be careful of our symptoms. If it is disabling, then we should take rest. Otherwise, no restrictions.
So, thank you, sir, for such a good discussion.
Thank you.
And I hope everybody's doubts regarding jaundice in this season, which is often due to viral hepatitis, is solved after this podcast.
Thank you.
Thank you, sir.